Okay, I think we're going to get started. Thank you, everyone, for coming, whether it's morning or afternoon, where you are. We really appreciate your time. And today, we're really going to have it's a pretty brief but hopefully informative discussion, about 45 minutes in length, and we do have some time set aside for questions. For questions, you can email them to me. You can see my email address on the slide. You can also use the chat feature, and that chat, the questions will come directly to me. So, and we'll answer those questions at the end, and we'll get through as many as we can within 45 minutes. And then, obviously, if there are any additional questions or in-depth discussions, we'd be happy to talk to you offline, or I can email them as well. So, with that, we will get in to the agenda for the presentation. So we'll go through some quick introductions of myself. This is Kyle, Kyle Berry, and then as well as Andy Komiske. And we will go through that real quick, and then we'll talk about why market your practice, especially now. We're obviously in very different times that we've never been through before, but we can share some anecdotal thoughts in our research there. And then we'll go into the meat of the presentation, an urgent care case study, and how we did what we did, and the different results that we're seeing from that. And then we'll discuss, basically how the digital marketing that we are doing for the urgent care center can apply to your business and to your practice and to your, because we have a lot of different healthcare type businesses and facilities and clinics on the call today. But anything that we're going to talk about today is going to be applicable to most everyone, and probably if not everyone on the call. And we'll kind of go through what that means and how you can apply it to your business. And then the things you can do like right now to make an impact. Some of these things are, most of the stuff that we're going to talk about are very quick impact kind of technologies and tactics. So we'll talk about that briefly. Then again, we talked about, well, we're going to have room for questions at the end. So really quick, Andy Komiske is the founder of the business side, the company that he and I both work for. He's an expert. He's had 25 years of experience, 30 years of experience running and understanding the inner workings of a healthcare practice. So he's not a practitioner. He does all the other stuff, the business side of healthcare, like billing and marketing and operations. And he has an in-depth knowledge of how that works, and really to maximize efficiencies on the inside and the business side of healthcare, so practitioners can do their very important work. And that's not something that we have expertise in. We focus on the business side. You guys focus on the clinical and helping patients and client side. I am Kyle Berry, and I have 20 plus, 25 plus years of marketing experience, most of it in technology and healthcare. So, bringing my experience to this, together, Andy and I and the whole TBS team are helping our healthcare clients, and in this case, deal with marketing issues and marketing challenges. So with that, I will turn it over to Andy to talk about, why market your practice now, especially during these crazy COVID times. So Andy, if you want to take it away.
Thanks, Kyle. What is marketing? Marketing is simply telling people that you have a service they may be interested in, thus allowing you to do more of what you do. Most private healthcare practices don't market their services today. Besides private healthcare, I don't know any service industry that doesn't market their services. The saying in healthcare used to be, "My phone just rings." I think we all learned that didn't happen these past months. I've worked with private healthcare providers for the past 25 years and have been in the unique position of working with a private practice who was uncomfortable marketing, and then watched that same practice merge with a local health system and watch the health system grow the practice by marketing. Health systems market their practices because marketing does work. At the same time, there's been a rapid growth in digital marketing and the use of data to deliver the marketing message to the right person at the right time. I think this webinar is a good example of that. So the question is the question is to market or not. So if the question is to market or not, excuse me, if your competitors are doing it, you better be. And if they aren't, it's an even better time to market. Cost matters in private healthcare. It can be very expensive if you go to an agency and buy the package. That hits radio, TV, website optimization, and Google Ads. This is typically what health systems employ. Marketing can be affordable if you target strategies that work. If audiences are targeted properly, you don't have to wait the 16 weeks that an agency will tell you it takes to see results. We've had impact within minutes of launching a targeted campaign. Kyle will now walk you through an example that actually increased patients during this unusual time and how we did it. Thanks, Kyle.
Thank you, Andy. So before we get started on the actual what we did and how we did it, we've got a COVID caveat. And what that means is, obviously, COVID-19 has created challenges for everyone across the planet. But for our specific, urgent care center, and probably all of everybody on the phone, nobody wanted to go anywhere, especially to a healthcare clinic, where the quote unquote sick people are. People were scared, especially in the beginning, because, we didn't know a lot about what was going on. Our campaign started in April. And, again, it was at the height of the unknown. We didn't know, nobody knew. So, and obviously urgent care centers, all businesses in general were suffering, and we didn't know what to do or how to do it, how people didn't know it was safe or wasn't safe to go. So those are the challenges we were dealing with. But we also had a couple opportunities because it was a healthcare facility that we're trying to market. And, they had the ability to provide COVID testing. And you're thinking, oh, if I'm on this webinar, I'm thinking, oh, okay, you guys did COVID testing. That's why you saw so many patients. Partly true, but more than half of the new patient visits that we saw and we have been seeing and we're still seeing today were reasons other than COVID. Once we got past the initial first couple weeks of panic and, people really, really unsure what was going on with this COVID thing, we started seeing visitations based on what the marketing we were doing. And people were, they may more of aware of these healthcare facilities because of COVID, but they weren't coming in for COVID reasons. They were coming in for other reasons. And again, we're going to go through the case study, but I wanted to make sure we talked about COVID because it's extremely unique situation. And we had challenges and opportunities because it was a healthcare urgent care clinic that, we could capitalize on. So let's talk about what we did for the center from a marketing perspective. Now, when we first started coming up with this, idea for this webinar, we had 48 new patient visits. Now, in the interim, in the last couple of weeks, it's now up to 73. And actually, this is yesterday's data, and I checked today, and we've got 2 more visitors. So in the last 24 hours. So as you can see, and as you will see, this technology and this techniques, these are working and it's proven. It's not just we think this person came in, they did, and we have the technology and the proof that these people are visiting the clinic due to the marketing that we're doing. So back up a few steps. The challenge, of course, was, the urgent care center is based in Maryland, was seeing an average of 12 patients per day before we started. But they had the capacity to handle about 50 a day. So they, nobody wants their team, their staff kind of sitting around waiting for patients or doing busy work if you can see patients and help people. So that was our goal, is to get that up higher. So what was our approach? Well, we have a multi-pronged digital approach, and with 3 main goals there. To create awareness, we wanted to make sure people knew about our urgent care center. Keep the staff busy. I mean, that's kind of goes without saying. And then the most important thing is increase patient calls and visits. And how do we measure that? And how do we know for sure what we're doing is creating calls and visits? And we'll get into that. So how did we do it? We have 4 different tactics that we're using for the urgent care center. We're going to go through each of these. We're going to spend the most time on geo-targeting. and we'll discuss all the other ones as well. So geo-targeting, texting, email marketing, and Google My Business. You may have heard of some of these things. You may have heard of, obviously you've heard of text and email marketing, but Google My Business may be something new. And geo-targeting is a cool buzzword, but we'll get into the details on exactly what that means and how we're doing it and what kind of data we get from it. So real brief, a couple slides on geo-targeting. What is it? So let's pretend that your practice, your clinic, your business is the red pin on the map. Let's also look at the blue pins and saying, what if those blue pins represented your potential customers, your potential patients, your potential clients? Those are the ideal people that you want to reach. But how would you reach those people? Let's just say they're there. How would you reach them? You could try direct mail, you could try general advertising, you throw stuff on TV, on the radio, but that's scattershot. You're putting your message out to thousands and thousands of people that aren't relevant because they don't live in the area. They're not going to be, it's not convenient for them or whatever. So what geo-targeting does is you in the tool that we use, we draw a radial circle around your business. So again, the red pin is your business. And let's say this is a 3-mile radius, which is what we did for the urgent care center. We drew a 3-mile radius around the center, making a determination that if you're within 3 miles of this center and you're going to get our messaging, you're going to have a good chance becoming our patient if the messaging is on target and we're talking about the right things. So how does it work? Let's just pretend your practice is on the left-hand side. That's your logo, that's your company, that's your ad, basically. So anybody who walks into that circle represented by the people here, and they have a mobile device, a smartphone, which is 98% of the population these days, and they walk into that radius, they're going to get served your ad. So your ad could be talking about whatever, talk about your practice, talk about rehab services, talk about wellness clinic, whatever, a pharmaceutical business, pharmacy, whatever your business is, as soon as that person walks in, drives in, is in that circle, they get exposed to your ad. Those are called impressions. So that's geo-targeting in a nutshell on how it works there. But the data that we get from this is invaluable. The data, the chart that you see here, you probably can't look at, can't see the details, but there's the green line represents impressions. So basically, how many times does your ad appear in someone's phone, or how many different impressions together collectively on phones that are in that radius. Now, the blue line is really the proof in the pudding. What does those impressions lead to? What's the call to action? What do we want that person to do? Do we want them to visit our website? Do we want them to come in for a visit? In this case, we want people to come in for a visit. We want them to make a phone call and make an appointment, or just drop in, because this is a drop-in clinic. So the blue line represents visits. And as you can see in the beginning, well, there weren't many visits for the first 12 days or so, or 10 days or so. That's typical, because you've got to get the ramp up. This tool needs a little bit of time to get going. But as soon as we started seeing visitations where you see the little spike up, we're back in the tool, we're looking at it, we're figuring out what we can do to tweak it and change it and modify it. And then you can see the huge spikes of visitations. Again, this shows us, because it's tracking the individual's phone, where they go. So if they come into your radius, you've got them, they see your ad, they interact with your ad, and then they show up at, all the ones that were a spike here are people who actually showed up at the urgent care center at some point in the future. It could have been that day, could have been the next day, could have been a week later, could have been a month later. So the point is, they're being tracked. Now, they're not being tracked to the individual. We don't know that Mary Smith walked into our radius and then she ended up coming. What we do know is someone's phone that's tied to it. We don't have that level of data, and we don't want that level of data. That's a little bit too much of a big brother approach. But we do have the ability to talk to gather data as far as, this one slide here talks about male versus female, and the grouping of the age groups as well. Again, we get an age range, we don't get the individual information. But this is extremely valuable information for us to know as marketers, because we want to know who are the target market. We know anecdotally because we have patients, we have clients, we have people that come into our business, and we know that. But how do we target those people? So this tool allows us to look at the data, and you can see here, this is real data for the urgent care center. The majority of visitors, this is just visitor data, majority of visitors are male in this case, opposed to female. And you can see the age group is 25 to 34 is the majority of the age group, people who visit. But at the same time, they could be coming with someone else. They could be, they could be the one that interacted with our ad, but maybe they're bringing their son or daughter or whatever to the practice. But that gives you an idea of geo-targeting, how it works. There's so much more we could go into. There's behavior statistics that, over time, we will learn like what these people do outside of our clinic. So do they shop at a certain store? Do they eat at a certain restaurant? And if those trends develop, then we have additional marketing avenues to go market. So if they're all going to Best Buy and eating at Outback Steakhouse, well, that's two different markets we could go after if it made sense for our business. So there's all kinds of data we can capture through something like this. So in a nutshell, that's geo-targeting. So let's briefly talk about the other components of our marketing campaign. Text marketing, pretty straightforward. I'm sure everyone has participated in text marketing in the past or currently. So you get a text, friendly reminder about this X, Y, and Z. It's great to communicate to your current patients, and we included this in here because it's part of the overall marketing mix. We're attracting new patients, but we're also getting some of the previous patients to come back. So in addition to new patients, we're also talking to current patients and getting them to come back for wellness visits or COVID testing or whatever is makes sense. And it's obviously a good way to communicate quick, timely messages, such as you have a telehealth offering or COVID-19 testing, or the office is now open, or different hours, or new procedures, wear a mask or whatever. Texting is great, but by itself, it's not going to change your business. But part of this overall marketing package, it's going to make a significant impact because you're reinforcing the other campaigns. So pretty straightforward. Texting is fairly inexpensive as well. So Google My Business. So if you aren't familiar what this is, Google My Business is the fancy, what I've got here in the slide is the fancy search results off to the right on Google. So if you Google something, sometimes you get this, what's highlighted in green on the right, you get this additional information about that business. Website, directions, call information, you've got reviews if it's required, you've got exams, and you've got photographs, you've got promotions of products and services. The businesses that have that have a significant advantage from a search engine perspective and business perspective, because the search results that are driven from or are driven from here are invaluable, and you're getting additional people to your business, you're getting phone calls, you're getting directions, you're getting people just being aware of your business. If you don't have one of these, and this is one of the things I'm going to say today, or I'll say it now and I'll say it again, you need to create your own Google My Business page today. It's free, it doesn't cost anything. You go out to Google and create it. But the key is you've got to keep this updated. Google loves fresh content. You've got to keep this updated, and the more updates you get and the more updates you give it, the more Google's going to think, oh, this is a relevant business. They keep all their stuff fresh. There's new content. Oh, there's new stuff. There's new stuff. Let's put them to the top of search. So this is extremely helpful for any size business. If you have a physical office space, it's even more important because then you've got the really, really simple, that directions button. And we'll go into some detail on what we're doing for urgent care and what the results were on that. So that's something you guys should do right now if you don't have a Google My Business page. Here's some of the things that you get from Google My Business. Again, this is free. You get the most popular searches and what queries, what people search to find your business. That's really helpful information for all your other marketing that you're doing. And do they find you on the listings or like a search results, or are they searching on maps? So when you when you search for something, you have the option of clicking on the map or clicking on the text search results. Why is that important? Well, if you click on a map, if you're getting a lot of people click on maps, that means they want directions. They want to know where you are. They want to know how close it is. They want to know directions to your office or to your clinic. You also get really valuable information about how many people called your office because there's a simple call button on Google My Business search results that says call the office or call that business. And you want it to be very, very simple for someone to call you or make an appointment or visit. I mean, that's the key to get people to come visit. It's the same for visiting your website or requesting directions. Again, what's the goal? Do you want people to visit your website? Do you want people to make an appointment? Do you want them to call? Do you want them to stop by? Whatever those goals are, map it back to what your focus should be on everything, especially here. So it also talks about most popular times at your office based on geolocation. Okay, Google's also pretty good about giving you that information. They know how long people are going to be at your business. Again, you've got to have a Google My Business page for this. And if you see the chart on the right, this is just a phone call. This is actually for the urgent care center as well. In the last month, they had 98 calls, and that's just from the Google My Business page. This is not including any other marketing we're doing or any other stuff from a marketing perspective or just branding or just people driving by the center. This is just based on Google My Business. So that's an additional 98 calls that we're getting for absolutely nothing. I mean, as far as Google My Business is concerned. And it gives you so much more data that, again, for lack of time on this call, but there's so much more data that we actually used here in Google My Business to modify the geo-targeting that we're doing. And we saw a huge spike. Once we saw the data here, we went back into geo-targeting and we saw a huge spike in visitors based on that information. Google My Business showed us that a lot of people were coming or requesting directions to our center from a certain zip code. So we took that information, we went back into geo-targeting and said, all right, put more focus on this zip code, and we saw it spike up. So it's a constant care and feeding of these things interacting that really made a huge difference. Email marketing, everyone on this call is probably, you got email marketing by us. That's how you guys got on the call. But it's an important piece. And if you do it right, and if you do it effectively, it's a piece of the puzzle. You can't just do one thing and have, your business change overnight. The emails must be opt-in. It's kind of, it's, part of the process. And we recommend 1 to 2 email blasts per month to the same group of people. And it needs to be obviously relevant information. So, practice happenings, special announcements, COVID-19 updates, whatever it makes sense for your practice, for your clinic, for your rehab center or wellness center, whatever you have, whatever your business is, it needs to be relevant. And it obviously is a longer form medium, so it allows you to do longer articles, link off to other things to talk about much more than you're going to see in a text message or a geo-targeting ad. The ad that we showed, the sample ad, is, just think about an ad on your phone. There's not a lot of real estate to work with. So you've got to be really succinct there, succinct in a text message, but here on email marketing, you can expand it. But again, all these things need to be talking together and supplementing and working together as a cohesive unit. So let's talk about results. Like I said, all these things are working together. What did we get out of this? What did the urgent care center get out of this? Well, we talked about before, the average patients per day before marketing jumped in was about 12. They are now seeing, on average, with the marketing programs that we've implemented since mid-April, 31. They're averaging 31 patients a day. Now, some of those aren't new, some of those are repeat, but that jump is due to the marketing that we're doing. They're not doing anything else that's different. They're obviously the COVID effect, the COVID caveat is in here as well. But again, we talked about more than half of the people visiting the center are not coming in for COVID. They're coming in for other reasons, whether it's wellness, general wellness, flu, you know, physicals, broken bones, stuff like that. So this is a significant jump, and this is something we're very happy with. The center is very, very happy with as well. So that's the overall impact. And we talked about 73 new patients since mid-April. And you can see the spikes and significant spikes. And you see closer, you know, in the May 7th timeframe, we saw some things in Google My Business, and we made some changes, and wow, we saw a nice spike there. On May 13th, the next week, we saw something else, and we made some other changes, and we saw spikes. And then in early June, that's when we saw that one about the zip code. That was kind of a light bulb went off, and we were like, oh, we got to see what happens. And you know, this thing is constantly feeding and caring for the different, you know, have these things work together. How do you tweak something to make something else work better? And it's really worked very well since mid-April. So let's look at overall some stats. So geo-targeting, 73 visits we talked about. Texting, the phones are ringing off the hook each time we send out a text blast. It was almost, you know, it's funny, we got a call from the main person at the clinic, the head person at the clinic, and she's like, you guys have got to stop sending these texts out. Our phones are ringing off the hook. And she was only half kidding. She was kidding, but she was half kidding. So while that's, you know, as marketers, we're high-fiving like the phones ringing up the hook, but at the same time, you know, they have a business. We want customer service to be absolutely stellar. We don't want people going into voicemail or calls being missed. So from that point forward, the second time and then the third time, we staggered them a little bit so they could handle the volume. So that wasn't an issue after that. But again, a good problem to have, having your phones ring off the hook. Emails generated 56 phone calls, 12 appointments, and obviously there's brand awareness, which is very hard to measure, but you're communicating to your patients and interested people that aren't necessarily patients yet, maybe you know, referrals or whatever that you're trying to get in as patients. But again, the phone calls are being generated, appointments are being generated by the marketing that we're doing. And Google My Business, in addition to the stats and stuff that we talked about before, and the invaluable information that we get from Google My Business, we also got 470 phone calls overall. You know, the stat we shared earlier was just the last month, but since the start of the campaign, we got 474 phone calls generated from Google My Business, 16,000 photo views. So if you think about it, when you Google something, you look at the search results and there's pictures, you know, there's pictures of the center, there's pictures of the people there, there's pictures of the exam rooms, pictures of the parking lot, you know, how is it easy to park? I mean, all the stuff that people are curious about, we put photos up there. It's amazing how many people look at that stuff. And, you know, as you can see, 16,000 photo views in 3 months. And then 143 people said, you know, how do I get there? What are the directions to get there? So the information is invaluable. Again, Google My Business is a A lot of people don't do it. I don't know why. Maybe they're just not aware of it, but it's a hidden gem. It really needs to be part of everyone's marketing mix. But in conjunction with other things, it's going to be much more powerful because it provides so much invaluable data. So we're actually near the end, but I wanted to kind of wrap up with, like, how does this apply to the other, this is an urgent care center example. It should be somewhat self-explanatory to, like, how does it apply to my business? But here's some kind of tips. Like, who are you trying to attract? How do you apply these tactics to your business is based on who do you need more of? Do you need more of, what type of person? What is the target market? Using marketing lingo, who do you trying to attract? What are they, what's your ideal customer? If you were to jot down your ideal customer, Best Buy is infamous for doing this. This goes back, 10, 15 years. They call the ideal customer a person. They call her Jill. I think her name is Jill. And they have um, all the characteristics of Jill, what she does, what she eats, where she goes. Not that you need to go through all that level, because they went through painstaking research to do that. You could do that just based on, well, here's our, your business, and who your best clients or patients are. How do we go get more of them? And that's where we can help, but you got to define that up front. So who are you trying to attract? And what's the goal? Do you want them to come to a physical office where you want foot traffic? Or do you have an online presence? Do you want to drive them online to do something? Or is it a combination of both? Because that's going to play a big part, a big role in what you do from a messaging standpoint. So what you can do right now, I mentioned it a few times, is set up a Google My Business account and update it frequently. This is not something you can set up, or you can, but you shouldn't set up and walk away. You need to set it up and constantly care for it. Give it more information. Google loves fresh content. Google loves fresh information. So keeping it updated is really, really important. You saw how many 16,000 photo views. That's really important to keep more photos up there. And anything you put up anything you put in an email newsletter or in a text or in a geo-targeting ad, that's important information that you want. That needs to be on Google as well. And that's a great way to kind of think about it. You have a set of content. Where are we going to put it in all these different places? So yeah, based on that, so create a content strategy. So the first thing, once you figure out exactly who your audience is going to be, let's figure out a content strategy, and let's talk, what are we going to say to these people? How are we going to say it? What are the tactics we're going to use? Based on what we just discussed, we've got tactics kind of figured out, but make sure you plan accordingly. So again, texting about twice a month, email 1 to 2 times a month, but geo-targeting and Google My Business is ongoing. It's completely ongoing, and it's something that you, again, can't forget, and you got to constantly be in there tweaking it and changing it and modifying it, where the other two are kind of just, you send it and you hope you don't have typos in it and you send it away. So with that, that is the end of the formal part of the presentation. I did see some questions pop in. So if you want to send any questions, go ahead and use the chat feature, or you can email me. I do have a couple of questions here. Let's see. The first one was, if we were to work together, how soon could you get started, and how soon could we have some of these tactics working for us? Now, Andy mentioned this in the beginning, that some of these are immediate. Now we want to make sure that, let me just back up a second. So not every business is exactly the same. So if we wanted to work with, if you wanted to work with us, we wouldn't necessarily say, all right, you've got text, you've got email, you've got geo-targeting, and you've got Google My Business. Now, probably we'd end up with some flavor of all those, but it depends. It really depends on the nature of your business, where you're geographically located. Maybe it doesn't make sense to do one or the other, or maybe it makes sense to do more of one or the other. Um, so that it really depends on what happens, where you are, and what your business goals are, and what your gear and what your goals are. As far as timing, again, texting. Once we get the plan, the content strategy figured out, and when we have a schedule, texting is minimal time. It could be 24 hours. We can have something up and going. And then obviously texting is going to generate immediate impact to your organization. Yeah, I got a question about text blast. Yes, these are blast texts that are sent out. But the technology that we use for text blasting is we can also have one-on-one conversations. So if you send out a message to 500 of your clients and 32 ask questions as a result, you can have a text conversation with them through the tool. So you can have a one-on-one conversation after that initial text blast. And we recommend the text blast be very brief, informative, and then there's some kind of a call to action. Otherwise, you're kind of just doing branding. So call, visit the website, something, some kind of keyword, whatever. There's the next question was, would we be tied to any long-term contracts or obligations if we need to stop the program for any reason? Is that possible? Yes, it's possible, and no, there's no long-term anything. So we don't believe you'd want to stop it, but yes, the technology that we're using and everything that we're doing, geo-targeting, I could go in and turn off their urgent care center geo-targeting and today, and it would stop today. It would probably run through the rest of the day, then stop for tomorrow. Obviously texting, you could just not do it. Email, you could not do it. And then Google My Business, you wouldn't want to stop. So that is no issues there. As far as long-term contracts or obligations, that's not something that, we look at this as a partnership. If you aren't happy, if we aren't happy, then it's not going to work. It's like a relationship. So it's got to be mutually beneficial. Otherwise it's not going to be a good fit. And so we're not looking for, we're not an agency. We're not going to go out and, like Andy mentioned in the beginning, we're not going to wait 16 weeks for something to happen. And we don't have, army of people in the back room that you had to pay overhead for. We just want to make a difference in our clients' lives, and helping them with their business, especially during this bizarre time that we're in right now. And the last question I have, actually, I've got two more. Is this a one size fits all approach? In other words, would you do exactly the same thing for my primary care practice? I mentioned it's not necessarily, no. So we would take a look at your practice. We would probably recommend all of the different tactics, but it doesn't mean we would. If you're already doing, even if you're already doing one of these things, maybe you're already doing email marketing, you already have a Google My Business, great. We may have some comments and what you could do differently, but great, we would integrate some of our stuff into that. Or we may suggest something that's slightly outside of what we talked about today. There's social media marketing that we are actually starting to look into because, just to add another layer, because what we're doing is really working. We may not do it. We're going to look into it for the urgent care center. We may do that, social media marketing or Facebook marketing, and Google AdWords is typically not something we'd recommend, but again, it may make sense for your business. Let's see, the last question I have here. If you're moving into a new state, any specific recommendations prior to the move to begin promoting business? Yeah, there's a lot you could do there. Google My Business would certainly be one of those. You get your Google My Business page up immediately with the new address, because you're going to get is if obviously if you have the new physical address, if you have an address that you want people to visit, that's important because it's going to take a little while for Google My Business to crawl that page, to index it for search purposes. And that's going to be important to get that long tail thing out there. And there's a lot of other things that you need to be doing as well. Obviously, it depends on the nature of your business. If you're bringing clients with you, or if you're just starting up a new practice, there's all kinds of things you can do from a branding and awareness standpoint. But again, geo-targeting can be ready to go in your new location when you're there. So there's all kinds of things, and there's other stuff for grand openings and direct mail, all that kind of stuff that we didn't talk about today because it wasn't relevant. But from a new business promoting a new business standpoint, you can certainly grease the wheels for your arrival, and we're coming. Oh yeah, by the way, we're here, and get kind of a big splash. Okay, hopefully that answered the questions that were thrown in. If you have any other questions, their emails are on the screen. You do have, I will send out a link to this presentation at some point, probably tomorrow when the recording is available. And feel free to reach out to ask any questions, or if we can help you with anything. And again, this is not a one size fits all. Each individual business is different. Everyone has their own unique challenges, and but using these tools or tools similar, I feel strongly that we can help you build your business even during these crazy COVID times that we're in right now. Okay, well, thank you so much. I appreciate it, and I will talk to everyone soon. Thank you.